This is Dr. Sajid Maqbool again with another clip. We had discussed the pregnancy related issues and the care during pregnancy. Now, when it is time for the baby's birth, you have to, as a mother, get ready, and certainly as a family. And so, my suggestion would be that you do a few things. One, that you keep your obstetrician's number, contact number handy, and also discuss with her where is it that you're going to deliver and who is it that you're going to be able to contact. And this should be sort of rehearsed and practiced a few weeks before delivery, because sometimes the baby seems to be in a rush to come and you're caught a little unaware. The second thing that you need to do is to keep some stuff ready. A bag with some essentials, maybe some clothes and some essentials must be kept both for the mother as well as the baby, so that you're not caught unaware and not unprepared for this. So once the baby is delivered, at the time of delivery, usually the hospital that you go to has a team that looks after the baby at the time of birth. And although there may be other people, but at least one doctor and a nurse are usually included in that particular team. So when the baby is to be delivered, the team is already there, prepared. They have verified the information from the mother and from the obstetrician. And once the baby is born, the doctor and the nurse together immediately dry the baby and stimulate the baby a little bit and check the baby initially for a number of parameters. The most important is, of course, the breathing, also the heart rate and the temperature of the baby, as well as the movement and activity. And they also make an assessment initially of whether the baby has completed the full duration of pregnancy or not, and also make sure that there are no immediate problems that need to be tackled both physically and or function wise. So the baby is then weighed and then transferred to the nursery, unless of course the mother has had a normal delivery and the mother has had a local anesthesia, where the mother can handle the baby right after birth and actually feed the baby within at times 1 hour after delivery. If the baby has to go to the nursery, even if the baby has to go to the mother, the baby's weight is taken, the baby's height or length is taken, and the baby's head circumference is taken along with the heart rate, the breathing rate, and the temperature and the color of the baby. Oftentimes, when you look at the baby at that time, the head is a little swollen. The baby actually may look a little swollen, and sometimes the hand or feet are temporarily blue, which actually gets better with time. In case the baby is taken to the nursery, especially after a C-section, and if the mother cannot handle the baby is then kept under a warmer, and after a little bit of observation, a more detailed examination is done in the nursery. And that examination is more thorough. It is a complete physical examination. It's what we call the head to toe examination, to again make sure that the baby's weight, height, head circumference have been recorded properly. The baby's got good breathing, good temperature, good activity, and that there are no anomalies of any kind, no problems that the doctor can see. And after that examination is done, generally the baby can then be transferred to the mother depending on the condition of the mother. Generally, we don't prefer that babies stay in the nursery. We prefer that they go to the mother, but sometimes if the mother can't handle the baby, or if she's had anesthesia and she's lethargic or tired or under the effect of medicines, the baby may have to stay in the nursery for anywhere from 12 to 24 hours. So we will talk about care of the baby from here on in the next clip. But once again, being prepared for this process is very, very important and very vital.